This is Mallory. She is my new med student who's going to be with me for the next 6 weeks. So I'm going to kind of go through and show her what manipulations feel like, so she can kind of, because she's been doing it with me for the last week or so she can kind of see like the pressure that I use so she knows what we're doing. So I'm going to start, as I always start up here. So this is where your first rib is going to be, is up here. So I see a lot of students have issues here. So you see how it's kind of painful here, more so than it is here. I know you have a first rib that's here. I never check neck standing just because there's too much tension when you're standing. I always check when you're laying down. So I've got your spinous process here and over here, and I'm going to come down and feel. I feel you have an issue here. Kind of a whole group dysfunction here going on the right side. Do you have pain anywhere?
I don't know, honestly, my left upper back a little bit.
Now, I'm looking at your feet, and your feet look like they're even, and I don't see any issues there, so let's check your hips. So here's your iliac crest. Bring around to your PSIS. Go ahead and bend forward for me. You can touch your toes. Oh, she does have an issue. Come on up. Go ahead and lay on your back. A lot of people don't know they have hip issues until they find them. So the other thing I look at the external rotation of her feet, see how they kind of, so if you can see here, Kate, come around here for me. It's subtle, but her foot externally rotates more here than it does on this side. This is the side with the issue. So I'm gonna come up to your ASIs here, and I feel that this one is a little bit rotated up. So we're gonna bring, do you remember showing you this last week? So I'm pushing down on your ASIS and pushing down on your knee. You're going to drive your knee up to the ceiling. So go ahead and push. And stop, good. And then go ahead and push again. And stop. One more time. Good. Okay. All right, recheck. That's much better. If you see, it's subtle again, but her external rotation is now better on this side. Okay, let me come this way. So checking a neck when someone's laying down, much easier to do. So we're checking rotation of her neck. Try and relax your head for me. Good. And then we're gonna check side bending. She actually has pretty good motion in her neck. I don't really see any issues. And then I'm feeling, so what I'm doing is I'm translating your neck. So I've got your spinous process here, your transverse process here, and I'm really, you feel how I'm just kind of pushing. What I'm looking for is if it pushes one way easier compared to the other, and yours is good. But we had this first rib issue, so I'm taking my fingers. Go ahead and bring your arm up. So I've got my finger over that rib here, and I'm bringing your arm up until I feel a resistance point. It should be right here. Can you feel that? Can you feel that resistance point move up?
Yeah.
Right here. Yeah. So I'm pushing that down. You're gonna pull your elbow down your side. Good. Yeah, it doesn't feel good to treat it. Good. And then go ahead and push again. 3 to 5 seconds. Relax. Go ahead and push again. And relax. Good. And then we'll come back and recheck. And that feels better. So go ahead and flip over onto your stomach for me. And we'll check those couple spots we felt up here. Just put your head down in this cradle here. So you'll see sometimes I check from the side and sometimes I check from the head. It's just easier for me to feel these upper thoracics from right here. And you said you felt it more in your left or right?
Yeah, sometimes my left. It's not always though.
So I feel some issues here. Okay. So hers is more of a posterior rib on this side. So I am on the angle of her rib, and I am going to bring her arm up until I feel resistance. Pull your arm down to the table. Good. And I am taking that rib, and I am pushing it down, and I am pushing it lateral. Push, 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 push. Good. Relax. Push again. Good. Arm back up on the table. Good. Okay. Turn your head this way. And then we're going to switch. The cracking stuff that you feel, that's not something I ever teach you guys. It's just something that you need to do like a lot of schooling to be able to do.
Okay.
To do effectively without hurting someone. So when you see me do this, I'm not trying to crack anything. I'm literally just checking rotation in a back to see if it feels tight going one way versus the other. And so I can feel that there's some segments here. Low back's not bad. Go ahead and sit up. I'm gonna have you come around this way, Kate. Hold on. Okay, so I was feeling issues right in here in her thoracic region. It's easiest to treat a thoracic when a patient is sitting up. So I feel right about here. So I know the top of her scapula is at T3. So I'm at about T4, T5, I'm at T4 right here. So what I'm gonna do is I'm gonna check her extension. So extend your back for me. Good. And then go ahead and move forward. So like flex your back forward. So I'm feeling if this segment gets worse in extension or flexion, and that's how I'm gonna figure out what treatment I'm doing. Hers gets worse in flexion. So I know that the problem is here on her right, and it's a problem in flexion. So I'm gonna move her a little bit into extension, so move a little bit, good. And then I'm gonna turn her to her resistance point, and then you are gonna go ahead and take this shoulder and move it to your left. So push, 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 good, relax. And now I'm gonna move you into flexion. So I'm moving her into what she doesn't like. Forward, good. Now go ahead and turn again. Okay, good. And then bend forward. Good. One more time. Okay, and then come and sit up. So bring the patient back into neutral. We're gonna feel again, and that feels a heck of a lot better to me. And then we'll come down and feel the rest of her back. Lay back on your stomach for me. I'm just feeling some tightness within this muscle right here. So I'd go through and just do some myofascial release. So this is good for you to feel. So you feel the amount of pressure that I'm doing. That's the amount of pressure I'm doing for patients.
Oh, okay.
So it's probably a little more than you thought it might be.
Yeah, I think so.
And so what we're doing is we're just pushing down until I start to feel that muscle release. And I will let you know when I feel it release so that you know what kind of it feels like in you. Right there. Keep breathing. Good. Okay. Go ahead and stand up and see how that feels. Now you didn't have a lot of issues, so you might not feel much difference.
Yeah, I can definitely feel up here.
Awesome. Okay, go ahead and stop that.